Welcome to this episode of JING TV, where we're going to talk about the perfect piriformis. Welcome to this episode of JING TV. I'm Megan.
I'm Rachel. Hiya.
And we're excited to talk about the perfect piriformis. Can somebody have one? But in particular, actually, piriformis syndrome.
Where is it? Where to start off?
Oh, you want to talk about the location?
Where is it? Meghan Mari.
So the piriformis, perfectly placed, is on the anterior side of the sacrum, and then it comes down to the greater trochanter in a nice diagonal form. And although in dissection, the piriformis is actually not that big.
No, because you've seen it, haven't you?
Yeah.
When you did that dissection.
Yeah.
So it was really much smaller than you thought.
Much smaller. And the actual lateral element down to the greater trochanter is really tiny.
Okay.
But the trigger points, which we'll talk about in a minute, can sometimes make it feel like it's as big as a golf ball, like an absolutely massive muscle.
It's quite interesting because when you did that dissection, you said that two of the muscles that we get really good results on clinically, quadratus lumborum and piriformis, were actually much smaller than you thought, right?
Yeah.
Same with the QL.
Yeah, no, it's true, actually, much thinner. I mean, I'm also very aware of when we do dissections at the Institute, we often are dealing with specimens, human beings, who've given themselves to science later in life,
right,
and they may not have used those muscles a bit as much. So it was...
They're older.
They're older.
You were trying to say really nicely.
Anyway,
piriformis.
But the quadratus femoris was massive.
Okay.
That was the big thing I really got. It was a big pillow. Anyway,
we digress. Back to piriformis and its perfectness.
So it's perfectness. And so one of the things that people can develop is piriformis syndrome. And when they end up in the clinic, they say, I have sciatica. And we know, first of all, sciatica is not a condition. It's not a pathology.
It's a symptom, not a diagnosis.
It's a symptom,
right.
not
it's
a diagnosis.
Good soundbite.
So that kind of pain pattern can be coming from a herniated disc. It be coming from trigger points in the QL, coming from lots of different things.
SI joint syndrome.
Right. So...
yeah.
In particular, I want to talk about why that might be coming from piriformis.
Yeah. So one of the things about the piriformis muscle is that it does pass very close to the sciatic nerve. Anatomical variations mean that the nerve can go over the top, underneath, or in some unfortunate individuals, right through the middle. The sciatic nerve is really long. I believe it's the longest nerve in the body, and it's about the width of my little finger. And if you actually really train yourself in your palpation skills, you can actually learn to tune into this muscle, this nerve at different levels.
It comes all, and parts of it come all the way down into the Achilles tendon, so you can kind of get the sense of the length of that pain that can happen if it's impinged.
So a very common problem, isn't it? Numbness, tingling, pain in the buttocks and down the back of the leg. And as we said, there can be various causes: herniated disc, being compromised by the SI joint in some cases, or in this case from a tight piriformis. And again, we have had very good clinical results from treating the piriformis. Although I do notice research-wise that some people are actually questioning whether piriformis syndrome exists to the extent. Yeah, that's true. Research questions a lot of things. But we have found good clinical results in clinic from treating the piriformis. So two things. One, you can get trigger points in the muscle that cause it to be short. And then it presses on the nerve. And the other thing is you can actually get trigger points in the muscle that cause a referral pattern down the leg as well.
That's the definition, isn't it, of piriformis syndrome. So that's something to be really clear about. What is piriformis syndrome? Although I would say that it's very rare for people to come in and say, I have piriformis syndrome, right? They just say, I have sciatica.
Yeah.
So the techniques that we tend to use, first of all, piriformis, what's its action? It's an external rotator of the hip, one of the deep 6. So trigger point, work in it. Also some really nice, chunky kind of fascial rolling, right? kind of really getting that whole entire area and kind of freeing it up.
Yeah.
Doing lots of stretching work to the client's tolerance. And in particular, we really like soft tissue release. So soft tissue release seems to make a really big difference with the piriformis to sort of free the sciatic nerve. And I'd have to say, because lots of people ask us, can you tell the difference between if the piriformis is really tight because of trigger points and impinging on the nerve, or it's actually not touching the nerve, or the nerve feels free enough and there are trigger points in the piriformis causing the referred pain pattern? And I would say generally, you know, I can't tell the difference. I'd actually treat both of that the same.
And again, with the JING protocols, it's a bit of a no-brainer because you're actually always treating all of the muscles around the joint. So without a doubt, we would say, even if you're really sure it's only the piriformis that's involved, there will be other muscles around the joint that will be compromised. So always treat the erectors, the QL, all of the gluteal group, including glute medius and glute minimus, which you can do side lying, and the psoas. And we show you how to do all of that in the online course, don't we?
Obturatus internus, externus, the Gabellus twins.
Yeah, we don't show you that in the online course. We don't.
But those are good. Give them a bit of love.
That's it, yeah. And always use a combination of techniques. So not just trigger point. You know, we recommend that you use a combination of fascial work, trigger point work, acupressure points. There's some great acupressure points for piriformis syndrome. Stretching and teaching your clients some stretches they can do themselves. And all of that, you'll get great results.
And where can somebody find the online course, Rachel?
Oh yes, okay. I keep forgetting to do this bit, don't I? Because we've swapped. You can look at all this information on our great online course, which you can sign up for. We'd love to see you there on treating low back pain. And you can follow us on Facebook or Twitter, which is my preferred method, at JING Institute. And you can also sign up for these video vlogs on iTunes.